Hello everyone, welcome to Studental. My name is Dr.Priya Patil Chaudhary and I'm a prosthodontist. Today we are going to see what are resin bonded fixed partial dentures. In university exam, it comes as short answer question and sometimes other questions are Maryland bridges, Rochet bridges and what are Virginia bridges. So let us see. We are going to see what are the indications, contraindication, advantages and disadvantages of resin bonded fixed partial dentures, what are different types of it, the technique, the cementation procedure and post-operative insertion management. So as the name suggests, these are the processes which are cemented to abutment teeth using special resins. Hence, it is called as resin bonded fixed partial dentures. It is one of the conservative way of replacing single. So this is one of the conservative way of replacing single missing tooth. How resin bonded processes look like? You can see here the resin bonded processes, they have butterfly like wings over the pontic surface. Coming to the history part, in 1955 the Buono introduced the acid etch technique. After that, in 1962 the Bowen developed bis GMA composite resins which can adhere to etched enamel. In 1973 the Alan Rochet gave a technique for splinting mandibular teeth using resin cement. Hence, later on they are called as Rochet bridges. So, what are the different names of resin bonded processes? Resin bonded processes are also called as adhesive bridges, Rochet bridge, Maryland bridge, McLaughlin bridge, resin bonded retainers and acid etched bridge. So, what are the indications? Mainly, these bridges are given when single missing tooth is present. So, single missing tooth with abutments having sufficient enamel to etch for retention. Then, replacement of congenitally missing tooth in young patients, splinting of periodontally compromised teeth, stabilizing dentition after orthodontic treatment, single posterior tooth replacement and patient with favorable occlusion. So, with the patients who have bruxism or deep bites, it is very difficult to give such type of processes. In the contraindications, when patients have known sensitivity to base metal alloy, we cannot give these bridges. When facial aesthetics of abutment require improvement, when there is insufficient occlusal clearance to provide 2 to 3 mm of vertical retention, inadequate enamel surface to bond, the incisors with extremely thin faciolingual dimension, the long spans involving 2 or more missing teeth, and the patients with parafunctional habit, as I mentioned, like bruxism patients, we cannot give the resin bonded fixed partial dentures because there are more chances of debonding. What are the advantages? As I mentioned, it is conservative way of replacing missing tooth. It is non-invasive to dentin with only lingual and proximal tooth modification. It is tissue tolerant because it has supragingival margins. The margins of these processes always lie supragingivally. It reduces cost with less chairside time, less stress to patient because no anesthesia is required. The rebonding is possible even if the process is debonds. It avoids the labial metal collar and provides both periodontal and aesthetic benefits in patient with high smile line. What are the disadvantages? Since it is not fully covering the abutment teeth, the longevity is uncertain. So there is no space correction possible in these cases, no alignment correction possible. Patient selection is limited because not all cases are favorable for going for resin bonded fixed partial dentures. The plaque accumulation may occur because the margins of these processes, they are favorable sites for plaque accumulation, usually restricted to single tooth replacement. We cannot use resin bonded processes for long span bridges. It is only restricted for single missing tooth or maximum 2 teeth, and that too when Conditions are favorable when there is occlusal clearance height is good. Then discoloration of teeth happens, and in resin bonded fixed partial dentures, temporization is one of the most challenging thing, or we cannot give temporaries in this case. So what are different types of resin bonded fixed partial dentures? Many times in Viva this question is asked that what are the different types of resin bonded fixed partial dentures. So we will see there are mainly 4 types of resin bonded fixed partial dentures. The first is Rochet bridge, second is Maryland bridge, third is cast mesh fixed partial dentures, and fourth is Virginia bridge. We will see in detail what they are. So coming to Rochet bridge, Alan Rochet was the first to design a resin bonded prosthesis, hence the name is Rochet bridge. In 1973, he first time combined mechanical retention with saline coupling agent to produce adhesion to metal. So in Rochet bridge mainly there is one pontic, and on pontic there are butterfly like wings on the side. In this butterfly like wings the perforations are present. These are like funnel shaped perforations. So, and the base of that funnel why are you laughing? So we will see what are Rochet bridges. In 1973 Alan Rochet first designed these processes, hence it is called as Rochet bridge. So he first time in 1973 combined the mechanical retention with saline coupling agent to produce adhesion to metal. So in Rochet bridge mainly there is one pontic, and on that pontic on the sides of it there are butterfly like wings. In those butterfly like wings there are perforations. Those perforations are like funnel, and the base of that funnel is facing towards the tooth structure. Hence this gives a micromechanical retention with the tooth surface. So we can see here that these Rochet bridges have funnel shaped perforations. After making such funnel shaped perforation, saline coupling agent is applied on this so that it enhances the retention. But the major disadvantage of Rochet bridge is that the resin which is exposed through the metal perforations is subject to external stress, abrasion and marginal leakage. So here we can see the design of Rochet bridge. Here we can see the cross section of Rochet bridge. This is a cross section of the wing of Rochet bridge, wherein we can see the funnel shaped perforation. The base of perforation is towards the tooth surface. Now we will see what are Maryland bridges. This is one of the most popularly asked question in Vivas and as short answer question as well. The Maryland bridge was given by Livaditis and Thompson. They were from the University of Maryland School of Dentistry, hence the name is Maryland bridge. In Maryland bridges, the mechanical retention was developed by the microporosities present on the tissue surface of the retainer. The microporosities are created by etching the tissue surface of the retainer. So in Rochet bridge, we saw that the wings of retainer were perforated like a funnel. But in Maryland bridge, the wings of this prosthesis are not perforated. They are completely covering the palatal aspect of your abutment teeth, but the tissue surface of those retainers are microporosity generated. Those microporosities are created by etching the tissue surface of retainer. So how these microporosities are created? That is, those are created by etching by 3.5% solution of nitric acid with a current of 250 milliampere per centimeter square for 5 minutes, followed by immersion in 18% hydrochloric acid solution in an ultrasonic cleaner for 10 minutes. So this is the way how the tissue surface of Maryland bridges are acid etched. So we can distinguish between Rochet bridge and Maryland bridge. In Rochet bridge, the wings of your retainer have funnel shaped perforations and they are later on treated with the saline coupling agent. In Maryland bridge, you don't have perforations to the wings of your retainer. Instead, the tissue surface of those retainers are acid etched, hence creating the microporosities and giving the adhesion. Now coming to cast mesh fixed partial denture. In this case, a net like nylon mesh is placed on the tissue surface of the retainer wax pattern. The nylon mesh is placed on the cast before fabricating the wax pattern. These retainers do not require acid etching. So in this case, while fabricating a wax pattern, a nylon mesh is placed over the tooth surface or the cast as shown in this photo, and then the wax pattern is casted. So after casting, a mesh like structure is reproduced on the retainer surface. Hence the name is cast mesh fixed partial dentures. We can see in the diagram that the mesh is created. So we saw a Rochet bridge with the funnel shaped perforations and saline coupling agent. Then we saw Maryland bridge. In the retainers of Maryland bridge, there are no perforations, but the inside surface or the intaglio surface of Maryland bridges are acid etched. In third case, which is cast mesh fixed partial dentures, it is easy to remember. Since it is cast mesh fixed partial dentures, a mesh like structure is present on the retainer. Then coming to what are Virginia bridges. So we will see what are Virginia bridges. This is the fourth type of resin bonded fixed partial dentures. The Virginia bridge was described by Moon and Hudgens, where they produced a rough retainer by incorporating salt crystals into retainer pattern. Hence it is also called as lost salt technique. So in Virginia bridge, the retainer surface of your prosthesis is treated with the salt. We will see how this is made. The retainer wax patterns are fabricated using resin. The 150 to 250 micrometer of salt crystals are sprinkled on the cast prior to resin pattern fabrication. The salt crystals get incorporated onto the tissue surface of the resin pattern. So later on, these salt crystals are dissolved by placing the framework pattern in water in ultrasonic cleaner. So usually the patterns are created using wax. In Virginia bridge, the pattern is created using resin. So resin pattern is created in Virginia bridge. Then the wax is sprinkled onto the resin pattern on the intaglio surface of prosthesis. Intaglio surface means the surface which is facing towards the abutment tooth. Once these salt crystals are incorporated, those salt crystals are dissolved by placing this resin pattern in water in ultrasonic cleaner. So what happens is these salt crystals are dissolved and a surface and microporosity is developed onto the resin pattern, and later on when the casting is completed, those microporosities are reproduced into the final casting. Hence this technique is also called as lost salt technique. So we saw fourth technique, which is Virginia bridge. Virginia bridge is also called as lost salt technique bridges. We will see. This is a cross section of retainer of Virginia bridge, wherein the microporosities are developed using salt crystals. So these voids will also be reproduced in the cast metal retainer and they help in the mechanical retention. So we saw the 4 types of resin bonded fixed partial dentures. The first one was Rochet bridge, which had funnel shaped perforations into the retainers. We saw Maryland bridge, in which there were no perforations in the retainer, but the intaglio surface was treated by acid etching. The third type which we saw was Rochet bridge. The third type which we saw was cast mesh resin bonded fixed partial dentures. As the name suggests, cast mesh means it has meshed onto the retainer surface of the prosthesis. And the fourth type which we saw was Virginia bridge, in which the salt crystals are incorporated into the resin pattern and they are dissolved and the microporosities are created. So after seeing different types, we will see the technique. What is the technique to fabricate resin bonded prosthesis? The first thing, just like any fixed partial denture prosthesis, we have to prepare the abutment teeth. After preparing abutment teeth, we have to make the impression and then casting of the prosthesis, and at the same time on the clinical side we have to give temporary restoration, although giving temporary is not at all an easy task in this case, and then the bonding procedure. So the preparation of abutment teeth is a very different thing when it comes to resin bonded prosthesis. The armamentarium which we need is high speed handpiece, articulating ribbon, small wheel and short needle diamonds, a flat end and round end tapered diamonds. So coming to preparation sequence. Okay, so this is preparation technique for anterior teeth. When we are dealing with the anterior teeth, first ask the patient to bite and then mark the occlusal markings using articulating paper. Then remove the 0.5 mm of that marking using wheel diamond. Then remove the palatal surface of your abutment using same wheel diamond burr. Then the countersink concept is there. The countersink concept means when you use flat end tapered diamond burr, so that the prosthesis gets a retentive and a stabilizing effect because of these countersink slots. So what it gives is, it gives you the stability and the retention so that the retainers of your prosthesis do not move and they stay stable. So what is countersink preparation? Using flat and tapered diamond, you make 3 markings on the palatal surface of your incisors, the depth of which is almost 0.5 millimeter. Then the proximal reduction is done so that the mesiodistal movement of your prosthesis does not happen. The proximal retention is done using flat and tapered diamond burr. After that, the for the proximal retention, same flat and tapered diamond burr is used. The preparation is extended little towards the facial surface and little towards onto the palatal surface as given into this photo. So this is how we prepare the palatal aspect of your anterior tooth to receive resin bonded fixed partial denture. So once the countersink is prepared, once the proximal surface is prepared, we prepare the marginal area. The lingual axial reduction is done using round and tapered diamond burr as shown in the first upper photo. Then the cingulum groove is made using short needle diamond burr. This also aids in additional retention and stability. And then one more proximal groove is made on the opposite proximal side using same short needle tapered diamond burr. The preparation for posterior teeth differs. In the posterior segment, we have the concept of wraparound design. So what is wraparound design? This alloy framework which is fabricated should extend to engage tooth structure at 180 degrees or more when we view from the occlusal aspect, so that it holds and grasps the abutment teeth in more than 180 degree or more than the circumference of those abutment teeth. For the posterior teeth, the occlusal rest is prepared. The occlusal rest is prepared adjacent to missing tooth, 1.5 to 2 millimeter in buccolingual direction, and same 1.5 to 2 millimeter in mesodistal direction, and the depth should be minimum 1 millimeter. The proximal resistance form is achieved by extending buccally beyond distobuccal and mesiobuccal line angle of respective abutments, preventing the framework from displacing in buccal to lingual direction. So this is how the rest sets are prepared. The vertical slots are countersinks for the anterior tooth. The V-shaped cingulum raised for premolars or the canine, and the occlusal rest set for the posterior molars. Now coming to impression making. Just like any impression we make for fixed partial denture, the impression is made in this case also. Any elastic impression material is accepted for crown and bridge procedure. That same can be used for resin bonded fixed partial dentures. We use addition silicone or we can use any type of elastic impression materials. After that, 2 casts are poured from that impression. One is poured with die investment stone, which is used for wax up because it is hard, and another is poured in type 4 stone, which is used for checking the fit and finish. The wax or resin pattern is proved in normal manner with wetting agent applied, cast and patterns are invested. So this is how we make the impression. So how we do the bonding for the resin bonded fixed partial dentures. The bonding procedure is one of the most important thing when it comes to resin bonded fixed partial dentures. There are commercially available many dual cure resin cements now. In the past, old version of Panavia was used. Now the recent version of Panavia resin cement is also available. The old version of Panavia was anaerobic, had anaerobic setting reaction that will not set in the presence of oxygen. The latest version of Panavia is dual cure, that is it is cured chemically and using ultraviolet light also. The other commercially available dual cure resin cements are from 3M we have Relax, from Ivoclar we have Speed Sim. But the Panavia is one of the benchmark and one of the resin cement which is used since past. So what are the steps for bonding? First of all, the fixed partial denture is placed in dissolving detergent. After that, the abutment teeth are cleaned with pumice and a rubber cup. The teeth are cleaned, they are air dried. The surface of abutment teeth are etched. Once etching is done, the teeth surfaces are dried with compressed air. Then the bonding agent is applied. Once the bonding agent or primer is applied, the cement is dispensed onto the mixing pad. The cement is mixed. the part of that cement is placed over the retainer surface, the intaglio surface of your retainers. Then the prosthesis is held into the place for 60 seconds stably without moving it. Once that is done, if it is dual cure resin cement, you can apply ultraviolet light, taking the help from dental assistant. Once that, after 60 seconds, remove the excess resin cement from the margins of retainers and clean the adjacent area. So what are the post-operative cares which we have to take in this case is that all resin bonded restoration should be scrutinized at the regular recall examinations, because resin bonded prostheses have more debonding chances, because they are not covering the full surface of abutment teeth. They are just lying onto the palatal aspect or the lingual aspect of abutment teeth. Hence the chances of debonding are more. The early diagnosis and treatment of a partially debonded prosthesis can prevent the significant caries. Since the margins are overhanging and they are not completely covering the tooth structure, the secondary caries are more prone to happen at the margins of such prosthesis. The restoration can usually be rebonded successfully if we find and diagnose it at early stage. If a prosthesis debonds more than twice, re-evaluating the preparation making the prosthesis is probably necessary. If prosthesis is debonding again and again, we have to evaluate what are the factors which are causing these prosthesis to debond, and we have to solve those problems because of which the debonding is happening. So we have to remove the cause of debonding so that the future debonding does not happen. Attention to periodontal health is also critical, because the retainer design in resin bonded prosthesis has been potential site to accumulate excess plaque. The patient should be taught appropriate plaque control measures when they are using such prosthesis. The calculus removal with hand instruments is recommended over the ultrasonic scalers so that the chances of debonding are reduced. Thank you everyone. So remember that the resin bonded fixed partial denture comes as short answer question and you should be able to answer them. I hope you will remember what are Rochet bridges, what are Maryland bridges, what is cast mesh resin bonded fixed partial dentures, and what are Virginia bridges. Thank you.